Berk Atakan is a 22-year-old who was once in the trials to play with Barcelona Football Club. But after a serious groin injury, he was bedridden for 6 months, which prompted a disillusionment with his identity, affecting both his body and mind.
But physically, I gained a lot of weight, I've lost a lot of confidence, and it did lead me to losing interest in the game.
Berk is one of many young people who have experienced negative repercussions of an injury, leading to depression and a struggle of identity.
It did affect me. At the age of 14 and a half, having my dad to, carry me to my room or outside, it didn't feel good. Especially seeing everyone who's my age doing everything they wanted.
According to a Professional Footballers Australia report, the shift for some athletes following injury causes mental health problems, such as anxiety and depression. For some young adults like Berk, resilience is hard to achieve, leading to a dropout in sport. One way to combat this is through physiotherapy. Tessa Hillig, a physiotherapy student at Macquarie University, says that positive thinking yields positive results.
Patients that come in with the expectation that they're going to get better are the ones that do have those improvements and that are faster.
For some, it's the continuing of control in their lives that enables a faster response to bounce back to sport. Dr. Gerard Forbrack at the Australian Institute of Sport says that athletes need to be given some control to ease their anxiety.
If you can show that there's a structured process that they can follow that's going to help their recovery, then you generally find that the athlete will get on board with that, because that is the one little bit of control that you have in this completely unknown and scary situation.
But the cost of physiotherapy sessions is sometimes a deterrent to those looking to jump back into it, says Ms. Hillig.
It is a shame that it's so inaccessible for young adults to receive physiotherapy, and the government allows 5 sessions with the Enhanced Primary Care Program, but that's only for all allied health, that's not specific to physio, so you can get $50 back for a session.
What's most important, however, is to seek help, physically and through those around you.
Talk to someone. That's the most important thing. You're not alone in terms of the difficulties that you're experiencing. A problem shared is a problem halved. We've heard that before. And that's really important in something like this, to be able to talk to somebody about what you're experiencing and what you're feeling and what your thoughts are around that.
It's not like a permanent resignation from anything they've liked before. It's just one thing that they're limited of doing, but there are millions of things that they can start doing and explore new things and find what they could also find something else that they're really good at. It's an opportunity rather than a loss to me.